Thank you for having me. Thank you, Paul. Thank you, Tamid, for the invitation. It's really a pleasure to be speaking in front of everybody. So as the title says, I'll be speaking about genomic medicine and the race to save lives. How is it important for all of us and also for the children, the babies. So, pretty cute baby here. We're now in an era where we can learn a lot of information, not only for the children, but also for our future. But I put this baby up here, so we'll be revisiting this baby and the story in a little bit. But I wanted it to really sink in so you understand why we're doing this. So this is a week-old baby, was admitted to the neonatal intensive care unit with acute liver failure. So we're going to talk about how we use genomic medicine in order to save this baby's life. But we also want to talk about how it can help all of us here. When we go to our physicians or we're sick, we get prescription medication, we can now use genomic information to help not only us, but the physicians help guide a treatment better. But what's really interesting is that we are about 99.9% similar in our genetic makeup. So if you look around in the crowd, you'll notice we're all different. So keep in mind that 0.1% difference. So in each of our 37 trillion cells of the body is the DNA that makes up you and me. That includes cells of the liver, cells of the brain. The DNA allows those particular organs to function and to work properly. But keep in mind what happens when there's some corruption in that DNA. So DNA carries all the information your body needs to function properly. DNA is made up of 4 letters, an A, T, G, and a C. Don't need to focus too much on the technical part of that. Just keep that in mind. It tells you how tall you are and your color hair. DNA is wound up in structures called chromosomes. We have 46 chromosomes, 23 from mom, 23 from the dad. All those chromosomes together make up your genome. And we have about 3 billion of these letters of DNA. The exact order of that DNA is called your genomic sequence. So whenever you hear the word genomics or genomic sequencing or next generation sequencing, that's what it is. It's really trying to determine the exact order of that 3 billion DNA molecules. So I always like to think of the genome as a book, okay? In a library, you have many volumes, which would equal to those chromosomes. So you have chapters, which are the chromosomes, but you also have sentences, which we might want to think of as the gene. So imagine, just like you're reading a book, it needs to make sense, right? So that sentence needs to make sense, much like the sentences in the cells or the DNA in the cells needs to tell your body how to function. So imagine you have the sentence, the gray cat ran down the hall, but you changed the H to a B, and now you have the gray cat ran down the ball. It might make sense, maybe it doesn't make sense, but really these changes in DNA can really affect whether or not we develop disease. So that 0.1% difference between us really influences what is affecting us. It might influence whether or not you have sickle cell anemia, you're lactose intolerant, you're tall, balding, etc. So your genome is what makes you a human, but your set of variants or differences, that 0.1%, is really what makes you unique. So as a geneticist, I always have to explain to people what is it that I do. So now we have the genome, and we consider the genome similar to an organ, a new organ system. So a cardiologist might have the heart, a neurologist might have the nervous system. As a geneticist, we have the genome to study, interrogate, figure out what's going on, see if we can come up with solutions to help people. All right, whole genome sequencing. So what does this mean? Basically, we now have technology that allows us to literally read the exact order of the DNA, all those 3 billion letters. How does it start? So to do this, blood or saliva sample is taken to a laboratory. It's where a machine breaks it up, and then we decode it, or it reads all of those letters. So just reading those letters doesn't really tell us anything, right? So you just have letters, machine reads it, doesn't really tell you if there's any differences from one person to another, why you might have disease. So what we do is we compare your DNA sequence to a standard. So the international community, scientific community, has a standard genome that we use as a reference, much like you have the original copy of a book, original book, printing of a book, but you have a copy. And so we compare both to see if there's any differences between the two and how that's significant. For instance, in this example here, you have the reference would have a T, your genome or my genome would have a C, and that is really what's giving us our differences in traits, whether or not you have a different hair color, height, or you have a certain disease. I think a lot of people know this guy from Game of Thrones. So he has a disorder called achondroplasia, and everybody with a G, right at that position, is born with this disorder. Doesn't matter. It's always 100% they'll have this. So this gene is in a sentence. This is a sentence in one of the chromosomes in that book that actually functions as a growth factor. So anybody who has that G right there, they cannot grow properly. I think we all know Angelina Jolie. Some time ago, she had a family history of breast cancer, and so she decided to test for variants in this gene called BRCA1. Anybody who has an A or a G at that particular site has an 85% chance of developing breast or ovarian cancer if it's inherited. So she decided to have a double mastectomy for preventative reasons. So that's one of the advantages of genetic testing, is that not only to get a diagnosis, but it helps your physician tell you how to prevent disease, how to monitor disease, and you can even take an active role. She might not, some people don't perform this procedure, but what it does is it allows you to go more often to your physician for checkups. So 12 years of school in about four minutes. All right. So why now? How can we use this information? Well, it used to cost a lot of money to sequence the genome. So in 2001, just to do one patient sample was about $100 million. With the advent of the technology I just talked about, right around 2008, you can now have your genome sequenced for a little less than $1,000 today. Okay, so clearly it is much more affordable, it's faster, and it's now becoming relevant. So you have your genome sequenced, or you sequence your DNA. We're reading those letters of DNA, right? And what do you do with it? You have your results. We know the information in our genes. It's very personal to us. We can speak to our physicians, talk about prevention, what drugs work, what might not work, monitoring, treatment, etc. So there's a lot of options we have with our genetic information at the moment. And this is all available. It's very, very cool. And that's a nerd in me. I think it's cool. Okay. Personalized medicine. It's kind of exactly what I just talked about. This is a new approach to medical treatment that uses a person's familial history, medical history, and gene to manage their health. Okay? So what personalized medicine is, and if you've heard about it before, precision medicine, it's really how to get the right drug to the right person at the right time after knowing their DNA information, or these differences between us. How does this work? Well, healthy individuals, as you might have experience with this, we don't always respond to drugs the right way. So the question always became, why? Well, when you have your DNA information, now our physician has that information, they can now take their patient population or the patients coming to the office, and they say, okay, this person there might be a drug that could be safe and effective. There's another group that could be safe and not effective, etc. So they can begin to stratify their patients on the same disease. They all have high blood pressure, they all have something going on, but we don't want to give them the exact same drug treatment. So knowing the genetic information, they could then tailor the dosage to give to one person or another. Okay, so one person might not metabolize a particular drug as well, and how do they know that? They know it by the genetic information. So you do the testing for that, physician has it, and can now tailor the medication appropriately to each person. Here's an example of a drug called Plavix. It's probably one of the most widely sold drugs in the world. Everybody who has a particular variant or that DNA change in this gene, CYP2C19, they are all poor metabolizers of this drug. So they go into the doctor's office. It's a blood thinner, basically used to prevent stroke and heart attack. Go into the office, and the old theory was you give them this drug, they should be fine. But what happened was they would leave, 2 weeks later they'd be dead from some sort of blood clot. It is now recommended by the Federal Drug Administration that everybody who is going to be put on this drug have genetic testing first to see if they have a variant in this gene. That way their physician can know to either prescribe something else or give them alternative dosage of drug. So the old way was you go into your doctor's office, you have some sort of disease, something, or blood pressure issues or whatever it might be, and the physician gives the same drug, the same dosage to everybody. But now using genetic analysis, we can personalize it for each person. It helps the physician, saves lives. So that's for all of us in the room, right? But what about the babies? They certainly can't tell you how they're feeling at the moment. They're very sick, especially the most sick who are in the intensive care unit. And so how do we use this genomic information and this personalized medicine and precision medicine to help? Just a few statistics. So in the United States, or actually in general, I should say, there's about 5,000 known genetic diseases. Known. There's still a lot we don't know. These affect about 3% of US children. It's the leading cause of death of infants. It accounts for about 14% of infants admitted to the NICU. Okay, so that's really, really high. And it's the leading cause of death of children in the pediatric intensive care units and the neonatal intensive care unit. But you can imagine with genomics and genetic testing, it has the biggest time frame or the biggest benefit, right? So somebody who's 85 years old might go into the physician's office, right? That time frame isn't as great, but if you're able to catch them when they're born, you're certainly saving an entire life. What about in the heir population? So defects of genetic origin account for about 3% of all pregnancies, 30% of pediatric hospital admissions, and 50% of childhood deaths. Of the top 10 countries with the highest incidence of of children born with a genetic incidence, actually 6 are in the Arab population: UAE, Sudan, Saudi Arabia, Palestine, Iraq, and Kuwait. So you can see how precision medicine really can benefit this region in particular. But why do we need to have such a rapid, important genomic test for babies? Because it's well studied and documented that the sooner you're able to get a child a diagnosis, the mortality rate will decrease. Okay, so the longer a baby lives without a diagnosis, the greater the proportion do not survive. So we want to live here as soon as possible, as early as possible. So Stephen Kingsmore, who's was a physician at Kansas City Memorial Hospital and now in San Diego, California, said, we cannot return a result for a baby that's admitted in the NICU in a month. We need to develop a technology where we can get a diagnosis within 1 day. So they developed a 26-hour whole genome sequencing. So they basically they can now take a baby's blood sample and look at the entire genome and give back a result within 24 hours. For that, they set the world record, Guinness Book of World Record for the quickest genetic diagnosis. And this is happening now in hospitals. Okay, so let's talk about the story of the world record story. Here's the baby, okay? Acute liver failure, admitted to the NICU. Time 0, they collected the blood sample from the mom, dad, and the baby. Within 2 minutes, because the testing is integrated within the hospital system, they were able to transport the blood to the actual testing center, the institute. Within 1 hour, they're able to isolate the genomic DNA from the cells, from blood. And 6 hours after that, they actually prepared the DNA to get on that instrument we talked about earlier, to decode the genome. 18 hours later, they were able to sequence the entire genome from the baby. Okay? So within 24 hours, they already had all of the data and all the information necessary to begin decoding the genome. What did they find first? So this is all obviously done by specialized computers, and it's called bioinformatics, but I won't go into that. But there are about 120 billion letters that they had to sort through to figure out what disease this baby had. So remember, there's roughly 3 billion DNA letters in the genome, and they had to start there. They were able to filter the 3 billion down to 4 million letter changes. So remember that 0.1%, right? So we have 0.1% difference amongst us. But this isn't causing disease, right? So there's a lot of information here that isn't even relevant to the baby. It just might be normal variations. 1 minute later, they were able to filter that down to 1 million variants that were very rare in the population. So these million changes in the DNA are only in 1 in 100 people. But you still don't know if any of those changes cause liver disease. So within 40 minutes, they were able to filter that 1 million down to 913 that were ever associated with any disease. So how did they take that 913 and associate it with liver disease? You can actually take the patient information, put it into a computer program, and it'll cross-reference those changes to anything that's ever been associated with liver disease. And they came up with 341 possible diagnoses. From there, they were able to filter it down to only 2 changes out of that 3 billion, or the 120 billion they started out with, that have been really closely associated with the disease that this baby had. They found 2 variants in a gene called perforin 1. The disease was called hemophagocytic lymphohistiocytosis type 2. But what's important is that this is exactly what the baby had. So they went from 120 billion DNA letter changes to just 2 within 40 minutes. What's even more remarkable is that the treatment is known for this. So they had no idea going in, but they know after the diagnosis that they can treat this baby with antibodies, a combination of steroids. Pretty cool, very, very cool. So here's the baby when we started out, and here he is at 4 years old. Liver disease resolved in 7 days. And if you think about it, they pretty much saved 79 quality years of life for this baby, almost 80 years of life. So what does the future look like? We all now can have our genome sequenced or go into it for a particular genetic test, develop a molecular fingerprint. Physicians have it. They can help you or me with our particular prescriptions. And we will also apply it to saving babies' lives. Thank you.